This is Wellness Wednesday, brought to you in part by Intermountain Healthcare.
It is Wellness Wednesday, and did you know that it is National Heart Failure Awareness Week? Heart failure is a medical condition that affects 6.5 million people in the United States. Jeff Goss is here with Intermountain Healthcare today. He is a family nurse practitioner with the Intermountain Heart Institute. Nice to have you here today, Jeff.
Thank you.
We hear that term heart failure a lot. Tell us exactly, what does it mean? What is it?
So heart failure, heart is the big, strong, powerful muscle, but sometimes it becomes weak or it becomes stiff. And when it does that, it has a difficulty putting blood flow to the body. And when that blood flow gets reduced to the body, patients get symptoms. They'll develop shortness of breath, they'll develop fatigue, activity intolerance, and sometimes they'll accumulate fluid in their legs or in their abdomen or in their chest, which make them uncomfortable and symptomatic.
Is heart failure something that can be cured, or ultimately is it the end?
For a lot of patients, it is a chronic condition, and there are treatment options that we have to try to improve symptoms and reduce congestion, but it is chronic and they'll need to be on medications for the rest of their life, and ultimately, yes, it is a terminal condition.
And a lot of people are dealing with heart failure, 6.5 million Americans. How can we prevent it so we don't become part of that group?
You know, it really boils down to those basic things that we always talk about. Eat healthy, watch your weight, avoid tobacco products, avoid those chemicals and substances that are toxic to the heart muscle, like illegal drugs and substances. Control your blood pressure is a big one, and knowing your numbers. Managing your blood, managing diabetes if you have it, keeping your cholesterol levels down.
Everything's all linked together.
All those basic things we always talk about from kindergarten up.
I tell you, exercise is the cure-all. It seems like for everything. Definitely something to think about. And of course, your diet. High fat, high caloric foods always seems to be a negative for
Correct.
Heart conditions.
Yeah, and we always tell patients, watch your fluid, watch the salt, and then just get those basic food groups.
Let's say
vegetables.
you're doing all of that, Jeff.
Yeah.
Are you still at risk of heart failure? Is there a genetic component?
Yeah, so there's the number one cause is blocked arteries feeding the heart, but then going down the list is high blood pressure, genetics, valve abnormalities, and we're learning more and more about genetics as we go along, and so we'll get more information as testing becomes more widely available and we recognize them better.
Is it men or women who are more at risk?
Both.
Both now, about
Yep.
equal. And what about age category? When are you as a provider seeing heart failure come in patients, come to be a problem?
So a lot of our patients are presenting earlier and earlier, sometimes in their 5th decade, their 6th decade, certainly in their 70s, 80s.
Sure.
We're seeing a lot of it, but we're seeing patients earlier and earlier. We have some patients in their 20s and 30s who are presenting with coronary artery disease because
Wow.
of lifestyle.
God, that seems so young.
It is young.
Yeah. Well, people that are sitting at home and they want to make a change right now, they may feel some of those symptoms you described, and maybe they don't have the best diet. What is their first step to getting on a heart health track?
I think the first step is making those healthy choices. If you have the symptoms, that shortness of breath, that activity intolerance that you think is unusual for your age, go get checked out. Talk to your family doctor and see if there's any tests that need to be ordered to look for this diagnosis. And then they can help you arrange a treatment plan that's suitable for you.
Yeah, going to get checked is the first step.
It is.
Talk about it. Yeah, early intervention as well. That's
Early
big.
intervention and prevention as much as we can.
Yeah, Jeff Goss with Intermountain Healthcare, the Heart Institute. Thanks so much for coming in and letting us become more aware during Heart Failure Week. Thanks,
you.
Jeff.